Hi, I'm Dr. Ria Haugseth, founder and director of the Pediatric Dental Team Association. So let's talk about your safety protocols or your different emergency plans that you have in your office. I'm sure you have one that is well documented and well rehearsed for if it's a patient in the chair and they have an emergency. So I'm sure you have that covered. But how about if it's somebody else in the office? Say it's one of your staff, maybe they've had a finger stick or they have fallen, or maybe it's the doctor. So what is your protocol to handle that? Have you written it down? Have you practiced it? How about if it's a family member of a patient in the office and they have an emergency? Maybe it's another child, maybe it's a grandparent, maybe it's a parent, maybe it's a pregnant mom who's fainted. Who knows what it will be, but you have what you want done, systematized and written down, and everybody knows their part. If you don't, this is the time to review it. So a staff meeting can do it, or you guys can just develop it, and then bring the staff together and rehearse it for sure. Make sure everybody knows exactly what they're supposed to do, and have it posted in the office so that they know. Does your staff know, in case of a fire, where the fire extinguishers are? Hopefully they do. If they don't, you need to make sure that everybody is aware of where they are, what they are used for, and what to do. And how to get the patients out of the office, how to make sure everybody is okay. I suggest you run some fire drills, and what I did was just take a piece of paper and draw a flame on it and write the word fire on it and leave it for somebody to find it. Then they start the drill. So it really needs to be off the cuff and not a planned one, but when you're practicing, sit there at the staff meeting and run through them all and go ahead and do that. So outside of those, what if you have a weather emergency? What if in your office all of a sudden there's a tornado or a hurricane or something else that has just come out of the blue? Maybe it's a blizzard. Do you have a protocol to make sure everybody is safe? If you have to hunker down in the office, how do you do that? Where do you go? What do you do? These are all ideas of different safety protocols for your office. What do you do if there's an armed intruder? I know that's a very scary thought, but in this day and time, we need to make sure we are prepared and we know what to do and who's doing what. The Academy also has some great information on safety in your office and safety protocols, so be sure and reach out and get that from the Academy, and that can help you develop that. PDTA members also have that available to them in the members' resources. There's kind of a template that you can use to help you develop your own. This has been your Practice Pearl, and I'll see you on the next one.